Okay, everyone. So thank you so much. We're going to start. Just waiting for 1-2 minutes for some of the people to join. Today's session is an open session, so I think if you want, anyone can share this link to your friends. So feel free to share it in any Telegram group or any messenger so that your friend can join actually and um, get some right directions before the exam actually. All right, so we'll be starting in a minute. So please let us know from which city you are attending this session. There's a chat option. So feel free to mention like from which city you are attending. Yeah. So just like to welcome dear doctors for coming to the session. Okay, great. All right. So it's time now, guys. Please mention in the comment section. I'm just giving a hi. So please mention from which city you are attending this particular session. All right, so that's amazing. Some of the doctors, yeah. Good to know. I do have a neighbor, I guess. Yeah. So welcome. Fantastic, guys. Actually, you guys are sporting. And as I mentioned, like if you have any friend, feel free to mention them or send the Zoom link. That'll be really great, actually. So let's go and start the session without any further delay. I think, yes. So we are going to solve this particular, recalls today, actually. How you guys are feeling? I mean, nervous before the exam or everything is going well? All right. Second, we're going to start. It's 5 minutes. And if you just want to have a look at 5 minutes, if you can. Right, everybody. So let's start. Like, how we like to go is, there will be a display of question in front of you. So you can see the question and it can answer in 10-15 seconds, actually. I hope so you know about the format of the exam. There will be 180 question and you need to, you know, clear. It's difficult to tell the passing mark in Plab, but it varies in between 115 to 123 in last 6 years, what I have seen. Okay, so it's like a 115 to 123. So it's like a percentile. Let me bring myself. Yeah, so it's like a percentile system. Like it might vary. Like individual question, how many people are correcting this question, how many people are making mistake. So they calculate that one actually. On the basis of that one, the final result came actually. Even if you go to the PLAB 2, it's also kind of like that. Now, these are the some particular things which I wanted to highlight. And if anyone is just attending this thing as a trial, for them, like, few things, you will find my details like a social media. Like if you have any further inquiry, definitely you can ask if you have any inquiries actually. Just like to add, like, a lot of people have gone through the PLAB already. They passed, they are working now. So really feel proud of many of those people. All right, so that's great. It's good to see. I mean, all are working. That's amazing. Yeah, so that's really, really great. Yeah. Okay, so that's how the things are. I think we will publish the 2023. I mean, very soon after the November exam. I hope so. All right, and I'm sure you guys will be there as well, right? And if someone is like next year, then remember it next year. Okay, and now let's coming to the things. This is how those of you have already subscribed. This is how a Google Drive, and this is how it looks like, right? So we are trying to solve the latest one, of course, and but many folders are given, right? Many folders are given. Let me just give you a demo as a trial. Just give me a second. Um, I'm just trying to give you a short idea how it looks like when you actually access. All right. So this is how it looks like. Those of you recently been joined, so welcome. This is how the drive looks like. So if you just example, if you're doing 2023, and if you click that one, so if you see February and May, these 2 months are updated. And today we are doing this one, that means the August. So we will be updating the August here actually. So a new folder, August will be coming up actually. Now, example, if we check out some of the previous example, let's click this February thing. So you can see some classes out there, some duration of the classes. So you can check them and also check the file. If you go back to 2022 Plab's example, so Plab exam, you must be knowing it happens 4 times in a year. So we try to solve like the relevant, like, try to like little script the things, we can't really exactly put the same way, but we try to change them definitely. So this is how the classes and this is how the files looks like. Okay, then even if you say me, yeah, so there's like you will always find like a 3 class because there is like uh 180 question. Every 80 question is not possible to collect all concept, difficult for anyone to remember. But at least like 150 topic, we try to cover up in that way into 3 classes. So this is how every single month is technically is given here, as you can see. All right, so this is great. I hope so. And other than that, if you like just keep going like that, you'll keep finding different months and things. So many walks have been I've been taking these classes since last, I think it's 4 or 5 years actually. And yeah, a lot of people have already passed. We just now saw that. Yeah, that was the slides. And I think without any further delay, I think we should go back to the slides. Please make sure that if you have any difficulty, you can let us know, like, if you're having any difficulty. Right. So without any further delay, let's go and yeah, start the things. And this is our plan for next some of the coming days, actually. All right. So this is how the drive looks like. You can always enter through the shared with me drive and you can just go through the files and all these things actually. Okay. Soon I will also share some supportive videos. So those videos can be very useful before the final exam. Like example, ECG video. It's a fundoscopy video. This sort of videos I will share very soon with you guys. So that will be also very useful for those who have already subscribed. All right. As I mentioned again, today's session is open for all. You can also please share the links with any of the Plab friends would be really kind actually, guys. I mean, nowadays people don't really want to, help each other. So I'm sure you guys are not like that. So anyways, this is how the plan we have designed. Like, this is the basic intro, which I just now mention. This is how what we're going to cover, and then we are going to cover some 2023 live classes, live question, and tomorrow, day after tomorrow, there are classes. Then I'll be those will be also taking admission or if anything. So yeah, how long is the session? It's like at least 2 hour 30 minute. That's minimum. Okay. So usually it's 2 hour 30 minute is the sessions actually. All right. Try to attend that one because uh, it will be beneficial for you. So 16, 17, 18, 19. So these are the things. So those of you will be joining in between, you can 19, we can again redistribute this 2020 to 2000 recall. So you make sure file not only Plab one keys and Plabable recall is very, very important, often game changer. Many people tell that actually. Okay. Plab exam is getting difficult. This is the part Plab exam is getting difficult day by day. So importance of recall or the question solving is much more. So the more you can do, the higher the chances of passing actually. All right. So this is the thing. All right. Now, if you have any inquiries, please save our numbers. Like before we start the session, sessions are coming up in the next one. Please save our numbers or take a screenshot so that if you have any further inquiries about the course or anything, you can contact us by WhatsApp or directly call in our office actually, right? With that note, are you guys ready? Please comment in the comment section if you guys are ready to. Yes. Okay. I don't want to kill your time because your time is very precious. Okay, so here we go. A woman with a 16 weeks pregnant, and she's worried about abnormal chromosomal anomaly in her child. What is the definitive? Guys, you can um, answer by unmuting. You can also answer in the comment section. It's up to you, actually. So what is the definitive investigation at this stage? This is 16 weeks. So guys, here is the time now. Time to participate, actually. What do you think, guys? No one is participating. I hope so. It's not a very difficult one. It's a question about the chromosomal anomaly. So most popular answer um, is amniocentesis, most cases, actually. So here is a technical thing I like to uh, check with you guys, actually. Like, often this question we answer as A, actually. Right. I mean, as I can see, most of you are also answering A. I'd like to show you an explanation. I could be wrong. I mean, I don't guarantee, but um, after checking some references, some question bank, all right. Now, coming to this part, let me show you that one, actually. Like, uh, often, I saw a lot of references question bank. It was A. So starting with a very controversial one. Now, uh, definitive investigation has a chronology in pregnancy 16 weeks. Now, what is the week? It was 16 week, actually. So I put as a CVS, but amniocentesis also can be definitely right. And we keep solving that one. Now, coming to some of the explanation part. Now, what is that explanation part? Explanation part, let's just say coronary villus sampling is a diagnostic easily performed, like, 30 weeks of pregnancy. CVS also involving some sample cell and this, that. Amniocentesis is another prenatal diagnostic test, but typically performed 15 to 20 weeks of pregnancy, while can also provide information about the chromosomal anomalies. Now, one of the things, like, CVS is a test, like, is often preferred a bit early stages, actually. So definitive investigation assessing chromosomal anomalies in pregnancy in 16 week, actually. Now, there's a dilemma in between these two, like a bit early stage, in bit early stage, actually, like a 16 week or early stage, we actually can do CVS. Now, since majority actually goes with the like the amniocentesis, I think this has controversy, but in earlier stages, you should keep it in the mind that CVS can be answered, because but majority of the question banks and the things I have find amniocentesis. So I think I'd like to go with the final answer amniocentesis, but I want you to give a thought also about the CVS sampling, actually. Like, this is mentioned 16 weeks. Now, if it is a little bit more early, I want you to answer the CVS sampling. All right. Is everyone clear, guys? Is everyone clear about that one? That about the CVS sampling. All right. So we will still consider the amniocentesis, but give a thought, actually. And especially if it is mentioned like a 14 weeks or something like that, to go for the CVS sampling in that case. For now, we are going for the A as an answer. Guys, if you just participate by answering something, that it would be also motivating for us, actually. Okay. During the classes, it becomes easy to proceed, actually. All right. Here's the explanation why the others are not the answer. All right. So here's the thing, actually, to early testing for chromosomal abnormality. Um, a CVS is a bit early, amniocentesis is later. Please remember this thing. Great. All right, moving forward. So previous one, we decided amniocentesis, but if it's mentioned a little bit more early, we will go for the CVS sampling. Guys, try mention as a, if you're following me as a yes, no, it would be easy for us to conduct the classes in that case. Okay. Okay. Breast after delivery, what is the causative organism? I think simple as that. That is a Staph aureus. Actually, everyone is quite a fast furious in the answer. Well done. Let's not go into much discussion in this one, because breast abscess, the abscess thing is mostly related to Staph aureus. Now, a quick question for you guys. Let's see, test of your memory, test of your basics about cellulitis. If I ask you the same thing, what is the causative organism? This is another exam question in past. Another exam question is, but this one is the absence. Now, if I ask you about the cellulitis, which one is the causative organism? Staph aureus, strep. In between these two, one you can pick up. If it's about cellulitis, and if I'm asking the microorganism? Anyone? Okay, maybe don't know. So answer is in that case is strep. Okay, so you guys don't know this one. Great. Next one is a lady came at a gynecology assessment unit with a history of 8 weeks of pregnancy, um, vaginal bleeding for last 2 days. On bimanual examination, it was 8 week inside. Speculation examination, os is closed. Now, keyword, okay, os is closed. Actually, how to confirm the viability of the fetus? Os is closed, and how to confirm the viability of the fetus. Okay, so in this case, to see the viability of the fetus, there's a very basic test actually, that is a transvaginal ultrasound actually. To confirm the viability of fetus, transvaginal ultrasound is very, very important. Here's the references and the things are mentioned assessing the viability, transvaginal ultrasound, and why others are not answered is also mentioned here. It's an easy one, so let's not kill much time here actually. 4-year boy healthy and loss of distal deep tendon reflex, high arch feet, and mother has also same history. Best to establish the diagnosis. Now, first, please mention in the comment section what is the diagnosis. Okay, so first, please mention what is the diagnosis. Okay, many I see you are answering this thing as a A. Okay, well done. If it is A, what is the diagnosis? Okay, we think this thing as a CMT actually, Charcot-Marie tooth disease. We think this one as a Charcot-Marie tooth disease. Now you can see a few things as a Charcot-Marie tooth, like deep tendon reflex, which was a key word for our exam. Yeah, and also the high arch palate. So high arches and that things would be there. So which is high arch is a common, which is called base scalpus actually. So electromyelography or this nerve conduction study. So this one is more correct. All right, clear everyone? All right, thank you so much. Next one, 45-year-old woman presents with the pruritus. Pruritus means like some itchy skin. Examination of skin pigmentation, investigation raised ALP, and presence of mitochondrial antibody. I hope you start guessing whenever we say anti-mitochondrial antibody, what is the diagnosis? Well done. So many of you can see the answer. So I think, yeah, not F, sorry, it's a E would be like, so the extra thing came up. So it's a primary biliary cirrhosis. I mean, it's okay. I mean, your answer is primary biliary cirrhosis. Okay, so main thing is here. These are the key points about like autoimmune disease damaging to the liver, again autoimmune. So raised ALP and AMA, antimitochondrial antibody. So these are the certain key things for primary biliary cirrhosis. And some diagnostic points. If left untreated, can lead to cirrhosis, liver failure, and some other complications. If you want to highlight this part, these are some of the stages. So this is how autoimmune disease affecting the liver, then affecting, you can see inflammation, because start involving the own tissue, then eventually fibrosis, eventually cirrhosis. So very important to treat that condition. 25-year woman presenting with diarrhea, abdominal bloating over last 4 months. So diarrhea and bloating. Examination, she has blistering rash over the elbow, and now see the labs. Okay, some lab points are given, including the adrenal biopsy, villi, and lymphocytosis. What is the likely diagnosis? I hope this is a very, very important question, and some of you can able to answer one of them actually. So in this case, actually, what do you think? Answer in this one, because the adrenal biopsy is showing shortening of the villi. So this is going towards a condition. What do you think? This is going towards celiac disease, shortening of villi and lymphocytosis. This is very, very common. So celiac disease is the final answer. So celiac disease final, diarrhea, abdominal bloating, keywords, and rash. Did you know when celiac disease associated with rash, it is called dermatitis herpetiformis? Did you know about this kind of condition? Like whenever a condition like celiac disease associated with rash, we call it dermatitis herpetiformis, and it is quite itchy at the same time. How to confirm celiac disease? By duodenal biopsy. Initial test for celiac disease, lot of like serological tests, like auto antibodies, some of the tests actually. So celiac disease is a very popular thing, intolerance to brow. What do we mean by brow? Barley, rye, oat, and wheat. So make sure you don't give this kind of thing. When you come to UK, or maybe some of you are living in UK, you'll find almost in every restaurant here in UK, like, it's mentioned that gluten-free diet, right? So this is a part of the treatment. Did you know this thing? Like this gluten-free. So nowadays, everything this is also becoming like a marketing policy, like gluten-free diet, gluten-free milk, gluten-free this, that becoming popular. So gluten-free and the lactose-free, these two are, quite a popular here actually. Now, last quick question, like normally celiac disease, what is the management? Gluten-free diet. If it is more severe, then what is the next step in the management? I will change the slide if you answer this one. Gluten-free diet is the first line. This is the mainstay of the management. But in spite of doing this one, it's not working. Now,
Methodology.
one step? What is the next step in the management? Anyone?
Methodology.
Salazine. Have you heard about Dapsone? I think Dapsone is a more convenient for this kind of case. So please pick up Dapsone if you see the Dapsone in the question stem. All right, great. Now coming to this particular question, a patient presents with a skin pigmentation, diarrhea, vomiting, abdominal pain, and postural drop. Please note the postural drop and pigmentation together. Electrolyte looking like this. Now, what do you think? What is the diagnosis first? What is the diagnosis? Or if you know the diagnosis, you can make a answer here actually. Now, what do you think, guys? Please keep participating.
Intersusception.
You can comment in the comment section, doctor. If it is a quiz type, then you can, answer. Okay. All right. What do you think, guys? Please comment in the comment section. Any guesses? Or what is the answer? Yeah. I hope you guys are like finding it useful actually, like, otherwise just try it actually. No problem. Just try it. Okay. Maybe you are not up to the diagnosis actually, All right. Someone is started writing. Well done. Someone is start thinking about like, this is the thing, you are going in right direction now. Now, if you think about the additions like skin pigmentation, is it common? Yes. Diarrhea can be common. Yes. Abdominal pain can be common. Yes. Postural drop can be common. Of course, yes. What is the tryout for additions? Now you guys can speak up. Someone wants to add something. What is the tryout for additions? Anyone wants, one can unmute the mic and also can speak. What do you think? What are the tryouts for additions? Feel free, guys. Open mic now. Someone was trying to add few things. Feel free to add now. What are the tryouts related to additions? There's three things, right? So three things are, one of them is first of all, like the three things in the trials, one is a hypotension. What is the next thing? What is the next thing? Hyponatremia. This is another thing. What is the third thing? Hyperkalemia. This all together, we call it additions, right? I hope you know this one. All right. Anyways, doesn't matter, but additions is related to these three triads actually. Look, additions also called adrenocortical insufficiency. So there is that adrenal gland. So the gland get affected, right? So eventually that leads to adrenocortical insufficiency, can be related to hyperpigmentation by melanocytic stimulating hormone that can be affected. So low sodium, that's another key thing. And high potassium, that's another key thing, and hypotension. So these three together, it's called the tryout for additions actually. Please remember it. So correct answer is a low sodium level. Normal sodium level is 135, and it is obviously more potassium 6.5 is quite high. So it's a very clear of addition. Are you guys clear? Please, please mention as a yes, as encouragement. All right. Is it clear to you guys? Okay, because if you mention, I get encouraged to answer or explain more actually. All right. Okay, coming to the next one. 28-year drug user presents to the emergency department, collapse and anuria. His serum potassium level is this. CXR is showing pulmonary edema. What is the appropriate management for this patient? So he's a patient related to a collapsed patient. Like so, an emergency is going on, and his potassium level, check his potassium level. So basically, you give a treatment as a severe hyperkalemia. 7.5 is way high. 6.5 is even considered, high, and now it's a 7.5. It's like very, very high. And patient is in real risk of heart attack now, right? So in this case, what do you want to give is a severe hyperkalemia treatment, serum calcium gluconate. All of you are answering correctly. All of you are answering correctly. It's not an indication for dialysis yet. Not that I think it's a calcium gluconate yet. So you try doing this, giving this calcium gluconate, see how the responded. If thing doesn't go well, then you can later consider for that, dialysis thing. Okay, I hope that's clear to all of you. I hope this is clear to most of you. Next question. 17-year boy presents the right testicular pain for 2 days. Physical examination showing scrotum is tender, scrotum is swollen, spermatic cord is thickened, can get above the lump, so you can get above the swelling. Now, what's next? Now, what is a diagnosis, first of all? Scrotum tender, I think you already know a diagnosis, guys. Scrotum tender until proven otherwise, there are two diagnoses. What are those actually? At least one. Okay. So in this case, maybe many of you might think about maybe torsion and this, that. All right. Okay. Many people are going through. Everyone is like that. There's like more other 20 people are like that. But guys, please try and answer. Try and answer actually. We'll reveal the answer. So it has been seen those participate more, um, higher chances of passing in the exam. So try participate more, guys. Okay, so you guys are testicular pain, you think about the torsion. Torsion. All right, high chances of torsion. Now, we see this is a 17-year is presenting with testicular pain and all this thing. All right, so that's thing about some of the initial actually. Now, did you see there is a ultrasound of the whole abdomen is given? Right. So there's an ultrasound of the whole abdomen is also given actually. Definitely we'll do next, of course, is ultrasound and then of course proceed by surgery. Now this ultrasound does not take that much of time. Okay, there are fast ultrasound and a lot of things are available actually. Okay, so you can do ultrasound and then immediately, if necessary, you will do the surgery actually. Presentive testicular pain tenderness thick instrument. So initial evaluation is by an ultrasound actually. Many of the question does not mention about the ultrasound, so hence we choose the surgery. So always be careful in the exam if ultrasound is mentioned, probably because it's not about the torsion. You also need to rule out some other things, right? So that is the reason, ultrasound you can do. Imaging study valvular, sync testicle, and the surrounding structure help to determine the cause of the pain, like torsion or epididymis or other scrotal condition. Now they have mentioned it another term like get above the lump or get above the swelling. Now, if this is a scrotal thing, and if you just check, so if you get above swelling, if it is possible, that means it is not a, uh, it is just confined to the testicle. It means that means if you examine this part, it is just confined to the testicle. But if it is mentioned can't get above, that means it might be a hernia things that is coming from above. That's why you can't get above the swelling actually. So it is not hernia, right? So always check in the question probably, because can get above the swelling or can't get above the swelling. This is another important thing. Here is the point. If ultrasound is mentioned, it is helpful to rule out the other possibilities. So sometimes you will be putting into such situation where you will be offered a procedure, where you will be offered an investigation as well. So you need to look into that one, that whether you need that investigation or you need something else. Clear, guys? So moving forward to this one, so ultrasound of the abdomen, then obviously we go for surgery if it is a torsion. So consider if torsion is confirmed. So you need to confirm it, otherwise why you will open up the patient. It's like a guideline for the some of the torsion cases, like nice guideline for the torsion cases. So you can have a look on that one. Okay, or you can check the file later. We can move forward with the next few questions actually. All right. So see, acute scrotal pain, it can be a torsion side and it can be a epididymocarditis side actually. If epididymocarditis, again, if it's a young person, STD like a gonorrhea and these things, you also need to rule out that one. Great. All right. I hope that's clear. It was a little twist in that question. Some of you made a mistake on that actually. So 32-year man is a psychiatric medication presents with a coarse tremor and a diarrhea. What is the most likely alternative drug causing this problem? I'm sure you'll be very fast answering this one. Great. So in this case, I think most of you choose lithium. I also think this is a lithium. All right. So answer is a lithium in this case. Lithium is used in cases like bipolar and many of the other cases it is being used actually, I think. So tremor, diarrhea, what is the alternative drug? So I think lithium is very much justified type drug here. A little bit more details about the lithium is given, as you can see. Can used in bipolar disorder. These are some of the actions related to lithium. Did you know that if someone is on lithium, weekly CBC is important, right? So the question can be twisted in other way, right? And another thing you should learn about the lithium toxicity. If lithium is a drug which has a narrow therapeutic index, so little high lithium can lead to toxicity. Now, if lithium level is more than 4, I repeat, more than 4 milliequivalent per liter, in that case, you need dialysis. And lithium toxicity with renal involvement and lithium level more than 3, also dialysis. So let me highlight what I just wrote. So we're talking about lithium toxicity. So if it is more than 4, you straight away go to the hemodialysis. But if it is more than 3, plus associated with renal, toxicity or renal impairment or cardiac toxicity, in that case, you can again go for the dialysis. So you see, lithium toxicity is a foundation for dialysis, right? Moving forward, this is a very popular one in the exam. Like I related this, one of those cranial nerve related question is so common in the exam. Young man complains about a double vision, saying to the right which nerve is the most likely involvement. What do you think? It should be an one answer for sure. So double vision on seeing to the right. So while trying to see on the right side, like, the person is having some sort of problem. Now, what do you think about the answer? Answer, well done. Most of you are answering very correctly. Answer is a B. Okay, so right abducens, that's the nerve. Now, abducens nerve is a which nerve? Fourth nerve, sixth nerve, third nerve. Abducens is which nerve? 1, 2, 3, 4, 5, 6. At least it would be one of them. Abducens. So since problem in the right, it's a sixth, right? So here is the thing. So failure to the lateral movement. Failure to the lateral movement. So our problem is this one. Please note, you can also get trochlear nerve like that. And the very, very popular eye position is down and out. Eye positions down and out. So this is related to third cranial. Third cranial is most popular. Other than abducens and trochlear can come in your exam. If you remember that mnemonic, all three SO4 LR6, all three like supplied by oculomotor, SO4 by fourth cranial nerve, lateral rectus by sixth cranial nerve. I hope you remember that. All right. Similar things moving forward. 56-year-old woman has a severe abdominal pain for 24 hours, radiating towards the back. Okay. And is accompanied by nausea, vomiting. She happens to be tachycardic and shocked. She found to have gallstone 2 years ago. What investigation to confirm the diagnosis? Okay. Time to reveal the answer. I think it's not a big deal. And okay. Most likely investigation to confirm the diagnosis. Now you see, here is the thing. Investigation to further confirmation, it has been mentioned. Now if it is a further investigation for confirmation, do you think it is ultrasound for a further confirmation? What is the likely investigation to confirm the further diagnosis? Is it the confirmatory or is it something like the initially we do? What do you think? I give you a chance to change the answer. Like if you want to change, what do you think? So ultrasound definitely we do for most of these cases. Further confirmation. Now, what is the diagnosis? Abdominal pain radiating towards the back. Very obvious, and had a gallstone history. I think now everyone knows what is the diagnosis. So the diagnosis is pancreatitis. Pancreatitis. Now, if it is a pancreatitis, what we can do for further confirmation? Isn't it a serum lipase, which is quite a specific test for the pancreatitis? All right. After doing lipase, then we can consider later CT scan. You should also know that. So at this point for confirmation, is the lipase. After doing the lipase, if it is doubtful, something more you need, you can further go for CT scan. So here the answer is a C, lipase. Clear? Please note, sometimes this question scenario can be given in this way, like abdominal pain radiating towards the back. And they might tell you flanks are full. Okay, so they can also tell things like the flanks are full or hemorrhagic spot, right? Gray Turner sign, Cullen sign. They don't tell about these things directly. They say hemorrhagic spots or flanks are full. This type of terms usually they like to use. So key answer is a serum iris. Diagnosis is a pancreatitis. Well done, guys. Also a serum lipase level you should also know. Okay. Next one. 34-year labor develops severe pain in his back. Guys, please remember back pain related one question is quite a confirm in the exam. After lifting a snack, San also complains of shooting pain down his leg. GP prescribed him complete bed rest. So with painkiller and scheduled for him MRI, what is the likely diagnosis? So his schedule for MRI for his back pain looks like a serious issue. His issue started while, lifting a sack of sand or sandbag, something like that. Now, what do you think about this one? Is it just a sprain or is it a more serious one? It is a disc prolapse, looks like, because trying to lift up something. So this is a disc prolapse actually. So severe back pain following heavy. This thing happened with my father as well. Do you have anyone in your family or any relative this thing suffered, or any one of you? It's not an uncommon scenario, right? It happens, you know, with a lot of people, like, vertebral disc prolapse actually. Okay. So here's a more things about the disc prolapse, like slipped or herniated disc, which is known as intervertebral disc. Eventually, we start with X-ray, but we do need an MRI for this situation. So includes, so disc prolapse can be back, can be neck in both of these cases. So you eventually need this MRI CT to further confirmation. You need proper rest, physiotherapy, and pain management, and injections, and all these things. Now, one important additional point here, surgery is considered when conservative methods are failed or ineffective, or where in some cases severe neurological symptoms are present. Okay, so in that case, you might need the surgery. Great. Moving forward, clear, guys? If say yes, we can move to the next task actually. If you write yes, we can move to the next task. Okay. Please note back pain related a lot question tested in past. Please check our previous files, like, those are like 2017 to 2023, which please check out, like, there'll be more questions about the back pain, check from our slides actually, or you can go to the Google, and also you can search back pain. You'll also find a few things from our slide actually. So check out all the back pain related. So once a back pain is tested in this August, so higher chances a back pain related question can be tested in your November exam or in your February exam. Very high chance. Next question. A man complains of loss of sensation. This is another very popular question. This pattern of question is so common. So popular question, and with a loss of sensation, ring, little and ring finger, most likely nerve that is involved in this case actually. Little and ring finger, if you know the dermatome, you will be able to answer this one very easily. So this is nothing but a ulnar nerve is getting affected here. Ulnar nerve is getting affected. So like, the ring finger and this, that, it's very common. I'll share a video just after the class. It is called the nerve root. So it will be very crystal clear after that one, solving this sort of problem actually. All right. So this in general, the brachial plexus, like what is, Ab's palsy related to C5, then wrist drop, there is a R, so radial nerve, winged scapula, deltoid paralysis, Saturday night palsy. So please have a look on them for the brachial plexus, and please check out this particular slides. Actually, this slide is also additionally you must need to read, because just reading the brachial plexus is not enough. Individual nerve and what nerve is damaged, you need to also look into that one actually, which usually not covered from the your question banks properly actually. So please check out this slide properly, this particular slides. Please make sure you go through. Like example, see, ulnar nerve at elbow, ulnar nerve at wrist, sometimes they are separately, as always may not be this. Ulnar nerve at elbow, you'll give rise to claw hand, whereas ulnar nerve injured at the wrist, by slashing of wrist, may not have the typical claw hand. So these are the differences you need to see actually. All right, so these three things are very, very important for your exam. Okay, this one was a easy one, but I have seen a more tougher one in past. I've seen a more tougher one in past. Trust me. Okay, moving forward, and I'll share that video. That video has a demonstration how to solve this actually. Okay, great. We're saving some time here. There was urinary retention in a 60-year-old man, and ureteric structures are normal on ultrasound. Catheterization reveals 650 ml of urine. What is the management? You have A, B, C, and D. This one is a bit difficult question compared to some of the previous. So I want you to try anything. I mean, whatever going on in your mind, try anything. A, B, C, D, whatever it is, you give a try. You give a shot first, actually. I can see some started with C already. So I would like to appreciate that one. Trial with, but I saw a lot of people are answering this one also with D, which is like, I feel incorrect. So trial, very well done, guys. I'm proud of you. Trial without catheter with tamsulosin is more correct. In this scenario, most appropriate would be trial without catheter. So patient had a retention, so able to pass 600 ml after. So suggests that urinary retention may be related to reversible conditions. So that is the reason without catheter, you try with the tamsulosin first. After trying, without catheter, if it is not working, then, we go to the, so the other one actually. If trial without catheter is unsuccessful, a catheter may be considered. Clear with the concept, guys? So let me show you the question again. So trial without catheter with tamsulosin. So we try C first, then D. C first, then D. All right. Moving forward, a man presents with a purplish swelling in the anal area and acutely painful, and he complains of constipation for last 2 months. What is the appropriate management? So in anal particular area, what type of lesions are more common? First of all, you need to know. So you must be knowing in this anal or anorectal area, abscess and these things are quite a common. So if those are common, I hope so you'll be given a picture. So it required incision and the drainage. And also, does this abscess sort of things does require an antibiotic or not? Answer, it required an antibiotic. So the diagnosis is perianal abscess. So the diagnosis finally is a perianal abscess. So sorry about that. Perianal abscess. Okay, so you need to incision and drainage at the same time. You need to go for a perianal abscess. Clear, everyone? This thing clear? All good. If you say yes, we can go to the next one. This is not much difficult. I think this one is a easy one. So far, I think one or two questions we found a bit difficult. Others are answerable. Well done. You guys are doing really great. Previously healthy 11-month-old child presents to your clinic with a 1-day history of high fever, runny nose, conjunctivitis. So child looks unwell and irritable. On examination showing child's oropharynx shows it is inflamed and there is a small white spot on the oral mucosa. So oral mucosa has a white spot, so which is the most likely diagnosis. just a 11-month child. And so if you remember the famous term cough, coryza, conjunctivitis, cough, coryza, conjunctivitis, very classic presentation. So this is going towards the measles. Well done, guys. And we can also see a few things related to cough plexus. White spots are kind of like a cough plexus. Otherwise, cough, coryza, conjunctivitis, those. So guys, please read much more details about the child with rash cases, especially where the rash is started. That's also very, very important to know. Okay, like for example, child with rash. Okay, just taking a second. Okay, so example, this one, if you see, I'm sorry, it's a little hazy maybe. If you see this one, a lot of type of here is the diagnosis. It's like scarlet fever. It started in the trunk, then goes to the extremity. Okay, then you can see staph skin condition start in the trunk. Then measles. Measles often we know started behind the ears, so it's started in the head, then entire body. Then syphilis, generalized involving palm and sole. So palm sole is the part get affected. Meningococcemia generalized very often actually. All right, so these kind of things are important to know that where the distribution of the rest. Example, Kawasaki disease. First there is fever, and then there is lymphadenopathy and rash comes. Okay, then there's lymphadenopathy and the rash comes actually. So that will be the diagnosis of Kawasaki disease, right? That will be the diagnosis Kawasaki disease. All right, we know about the Kawasaki disease already. I think everyone of us know about the Kawasaki a lot actually. This is something about the Kawasaki disease. In past, directly Kawasaki disease also has been tested. I mean, even in 2023 beginning, Kawasaki has been tested. So, and now they test this measles thing actually. So it means if you see the pattern, understand the pattern. So child with rash, one case is confirmed in your exam. So while you take a preparation, I want you to prepare very well with the child with rash cases. Agreed, guys? So child with rash, mumps, measles, rubella, meningococcemia, Kawasaki, any of these particular things can be given in the exam. Right, so we are moving forward with this one. This one's answer was measles. Yes, it's a measles, so crying. So low-grade fever, cough, coryza, conjunctivitis, and of course, Koplik. Yeah, and all these things. Yeah, Koplik spot, cough, coryza, conjunctivitis, and Koplik spot. Very similar with rubella, and another one is a roseola infantum. So all of them are important for you. Yeah, more additional child with rashes. Example, you see chickenpox are more pruritic. Also, rubella is more pruritic than the measles. So this can be some of the additional key differentiating point. Because in the exam you are puzzled. So these one, two small things really are so helpful in the exam. Okay, next one. 39-year man comes with the um, umbilicated papule on his face. Okay, that's interesting. Now, any skin disease with umbilicated papule, I hope so you know the diagnosis. A skin lesion which has an umbilicated papule. All right, I think most of you already captured and what it is. And CD4 count is 35. You guys are guessing the right. This is Molluscum contagiosum. This is nothing but Molluscum contagiosum. Maybe I can show you a picture. Molluscum. Just a second. Yeah, this is how it looks like. I'm sorry. So Molluscum contagiosum. Yeah, so this one is more classic. This one I wanted to show you, like this umbilicated. Yeah. So mostly self-limiting condition, spare the palm and sole. So a few keywords are here. So you'll be given high likely pictures in this sort of cases. Mollusca contagiosum. A boy chased his sister, fall and pale and drowsy. His head hit the corner of the table 40 minutes later. He's in good condition, blood glucose is this. No mention of the history of epilepsy, seizure in past. This is important to mark because many times this sort of situation can be related to seizure epilepsy in past. Now, what to do next in this case? CT scan, EEG, no need of doing anything. So his head hit the corner of the table. 40 minutes later, he's in good condition. So in this case, since there is no such vomiting, there is no such nausea, no such other dizziness. So looks is fine. So I think there is nothing actually needed. Actually, most cases, nothing needed. But let's come and see few things. Most of you might be thinking this one: boy chased by a sister, fall. There's a fall history. Drowsy. The head hit at the corner of the table. Okay, and blood glucose level is this. Let's come and see what is being mentioned here. Actually, in this situation, the child falls and hit their head becomes pale and drowsy. Now, if you know about the red flags of head injury, patient become drowsy. Is this a red flag for the doing the radiological scan? Just put something in your memory. Like, is this a red flag sign? A person having two episodes of vomiting, a person having become comatized or dizzy after the head injury. Are these things are the red flags? And if it is a yes, they are red flag, you need to do imaging test. Clear now, everyone? So in this case, the answer is a CT scan. Tricky, right? A little bit tricky, but that's the yes. This drowsiness is a red flag. Red flag. Clear? So please read or you can Google it. What are the red flags signs for the head injury? You will find the patient become drowsy or dizzy. This is they will be mentioning. It was a tricky, this kind of question. Make sure you don't make a mistake. Okay, this kind of question will be a parameter of your passing and failing, because there are some questions are very weird and very difficult question. You never may have heard about that one. Just move on to the immediate next question in that case. And guys, it's a good chance after November. We still don't know. I mean, but high chances that Plab things are shifting into UKMLA. We'll be also, update our everything into UKMLA in any ways. Okay. 55-year-old man presents with a swelling at the angle of the mandible. Okay, so this is more of a like a salivary swelling type of thing, swelling at the angle of the mandible, which is a progressively increasing, means slowly increasing and mobile for 6 months. What is the most likely diagnosis? What do you think, everyone? Does it look like malignant and any angle? Answer probably is a no. So we also think, as like you are also good going guys, like it's a benign parotid, we are thinking. The same situation if it is a painful, same situation if it is painful, we think it can be some sort of salivary gland infection or parotitis in that case. But in this case, we think this is a benign. Mandibular tumor, tonsillar carcinoma, and like may not be mobile actually. Now here is the thing to remember in case of salivary gland. In case of salivary gland, if it is inflammatory means if it is painful, then what test to do? In that case, test to do is an ultrasound. Salivary gland swelling, and if it is a solid, and painless cases, in that case, you can go CT or MRI. Why not FNSC early? If you try to do FNSC in a cancer, it is possible that you help seeding. The seeding, like spreading of cancer. That is the reason before the FNSC, you can still go for CT MRI. Clear, everyone? You can go for a CT MRI in this case. So here the answer is a benign, but this question can be given as in these directions. This question can be given with the Bell's palsy. Very tricky can be. Okay, next question. 34-year woman who never had fit or high blood pressure develop fit 6 hours after delivery of a healthy child, what is the most likely diagnosis? 34-year who had never had fits or high blood pressure. Okay. So fits develops which is 6 hours after the delivery. So in this case, actually, we think more as because pregnancy time and there is fits, there's a high chances it can be eclampsia. Eclampsia seizure occurs 24 hours mostly and majority in 12 hours. The single seizure does not support the epilepsy strongly. So I think A is more justifiable. And here is the main explanation. In eclampsia, seizure occurs within 24 hours mostly. Majority within 12 hours. So the time frame is supporting us actually like a 6 hours. All right, guys, we are going to take a little break here. I mean, you guys can go and do some refreshment.